Okay, good evening, everybody. Welcome. It's 7:59 p.m. When it's 8 on the dot, we are starting. I can see Chief is already set for us tonight. Good evening, sir. I'll be bringing you up very soon. I just wanted to get to 8 on the dot and then I bring you in and we're starting immediately. Yes. So let's do this. Okay. Good evening, everybody. Welcome. If you're just coming, you're welcome. Uh, welcome, everyone. Welcome. How are you and how was your Sunday? My guest is already set and he's waiting for every one of us. So if you're just coming, you're welcome. We have 20 people already in the house. Welcome, everyone. How are you doing? Okay, good evening. It's 8 p.m. You're welcome to Ask the Doctors. This is an online health program that holds every Sunday by 8 p.m. West African time. My name is Dr. Frederick Unuigbokhai, and I always tell you good life in a sense. We have some people be here. Alex, good evening. Jessica, good evening. Princess, that will be good evening. Tonight, we are talking about blindness, protecting the eyes from blindness with Dr. Cyril Obasuyi. And our guest is set. He's already in the house. So let me bring him up. Okay. Good evening, sir.
Yeah, good evening. Please confirm you hear me.
Yes, I can hear you loud and clear. Good evening, sir.
Good evening. How are you? Wow.
Very well. Very well. It's great to have you here. Thank you so much for taking our time to join us tonight. We really appreciate you, sir.
Yeah, thank you for having me.
We have people joining us all the way from Norway, from Austria. Could you tell us in the comment section where are you joining us from? Welcome. So our guest tonight is Dr. Obasuyi Cyril. He's a consultant ophthalmologist. He's an ophthalmic surgeon, cataract and glaucoma services at the Irrua Specialist Teaching Hospital, Irrua, Edo State, Nigeria. It's great to have Dr. Cyril join us tonight to talk about a very, very important topic as this. And this topic talks about blindness. A lot of people have problems with their eyes and they don't know. So if you have any questions on blindness, please take note of them. We would give you a certain opportunity to ask your questions, and Dr. Cyril will do his best to respond to you. But please be reminded that we don't prescribe here, no diagnosis, just advice on this program. Now, according to WHO, it was said that I saw that I think this week about 2.2 billion people have problems with their eyes, 2.2 billion. And even half of this population don't even know that they can prevent it. And some of them have not even gone for management. So I want to speak with Dr. Cyril tonight, sir. How common is blindness in our environment? What's the prevalence? Should we really be worried? Should we be concerned?
Yeah, thank you. I think the first question we need to answer is what actually do we call blindness? Do we want to talk about blindness in the sense that whoever we're discussing or whoever we're saying is blind does not see at all, or that
Okay.
the person does not have vision good enough to carry out their daily activity, or they don't have the vision that we think is necessary to carry out daily activity. And blindness to everybody is different. Blindness to the farmer would mean the level of poor sight that does not enable him to go to the farm anymore. Blindness to the market woman would mean the level of poor sight that does not allow her or him count money again. And the blindness to the pilot would mean the level of poor vision that does not allow him take off properly or fly at night. But thankfully, for those of us who you come to complain about your vision or visual problems, so there's a cutoff that we use. And we use 618 as the cutoff for people and for us to say, okay, you've got poor vision. If you come to us and we do some tests for you and we measure your what we call your visual acuity, if you can see better than 618, we'll say, okay, great, you've got good vision. If you can see worse than 618 after we've done your test for you, then we'll say, oh, fine, you've got some level of impaired vision. And so blindness, therefore, apart from being defined in terms of the visual task that the person needs to use his vision for I don't use it I don't, for I was going to say for epidemiological purposes or for purposes of carrying out um, research or for, let me say, categorizing people in the world or people in a particular location about how they see or how badly they don't see. Blindness is a big problem. Globally, um, the commonest cause of blindness is refractive error. And we have two forms of blindness, reversible and irreversible blindness. For reversible blindness, we mean that this is blindness that can be treated and then the person now can see better. For irreversible blindness, there's actually nothing you can do about this blindness. And once it starts, it will run its course. The only thing we can do is to slow down the progression of irreversible blindness. So for reversible blindness, the commonest cause is refractive error. And refractive error is when we can't see without using glasses. Most people complain they can't see far, or they can't see objects close to them, and then they need to use glasses to be able to see clearly. And then the next important cause of reversible blindness is cataracts. Cataracts is this clouding of the lens, and then vision becomes very cloudy, and then person can't see, and then we need to have surgery done, and then vision becomes better. So when you talk about refractive error and cataract, it's very common. It's very, very common. And unfortunately, there's been no large-scale studies in Nigeria since 2005 when the last national blindness survey was carried out. And even during that survey, it showed that a lot of Nigerians had refractive errors, uncorrected refractive errors, and cataracts. And so a lot of people go around without using glasses, and a lot of people go around without using glasses. A lot of people go around with cataracts, and these figures increase by the day. As life gets better, in quotes, standard of living improves, life expectancy increases. Therefore, cataracts level, the prevalence of cataracts is going to increase. We're going to have more people with cataracts. And then as we have more screens with us, more devices, more tablets, more phones, more TVs, refractive errors, especially myopia, is also increasing. So we have more people having refractive errors and cataracts now as compared to when we had that study done in 2005. And it's going to keep increasing, especially in countries like Nigeria, in Africa, where cataract surgical services are either too expensive or not properly available, and where people can't actually afford to get a pair of glasses.
Thank you very much, sir. For those who are just coming, you're welcome. We're talking about blindness tonight, and we have Dr. Cyril Obasuyi, consultant ophthalmologist. He defined what blindness is. To the market woman, blindness might mean she's not able to count. To the pilot, it might mean something else. Sir, I want to ask one question, please, for the audience. At what age really can someone be blind? Is there a specific age for blindness? Can it affect any age group, really?
Anybody can be blind, even newborn babies can be blind. Babies can be born blind, and babies can be born and then over 6 months become blind. You can grow old and be blind. So anybody can be blind. There's no set age for blindness. However, some forms of blindness are more common in some age groups. Like I mentioned earlier, cataracts are more common, grow older. This doesn't mean that cataracts don't affect babies, or cataracts don't affect children, or cataracts don't affect young adults. As we grow older, the more likely anybody can be. There's really no age group that are immune from blindness. Anybody.
I'm sorry, sir. I think we're having issues with your audio. It's not clear a little bit. It's breaking.
It's
I don't know
breaking.
why.
Is it better? Is
Yes,
it
sir.
better now? Is it
Okay,
better
it's
now?
better. Yes, sir.
Yeah.
Dr. Israel, good
So
evening.
as I
How
was
are you?
Good evening.
Please, sir, go ahead, sir.
so as I was saying, anybody can be blind. There's no age group. Blindness is not restricted to a particular age group. However, like I mentioned, I think before you lost me, some forms of blindness are more common or are common with some age groups. Cataracts are common in the older group. Glaucoma, which is a leading cause of irreversible blindness, is common in the older group. And but it doesn't mean that children that have glaucoma or young adults can have glaucoma. Anybody can be blind.
Anybody can be blind. Okay, somebody was saying the audio was not loud enough. I think it's better now. You can hear Dr. Cyril. So, sir, my next question would be, what are those signs or what are those symptoms for the patient? What are those symptoms someone can have that would suggest impending blindness? Or is the symptoms, are they asymptomatic? Someone could just be there and suddenly lose the sight. What are those common symptoms to look out for that might suggest impending blindness?
The most common symptom for blindness is you're not seeing. That's the most common symptom. There's no other symptom. And I will always tell people that once in a while, close one eye. And once in a while, close one eye after the other and see if you can see from any of those eyes. Because we have two eyes, one, the better eye tends to compensate for the other eye, which may not be seeing properly. So once in a while, just close one eye, close your left eye and see how well you see with your right eye, and then close your right eye and see how well you see from your left eye. And that will tell you if you have any problems with your eyes or not. So the most common symptom is poor vision, especially for those people who used to see very well. They're the people who would likely notice their vision is poor compared to those who've got some poor vision ab initio. They may not notice when their vision goes bad, but the most common thing is poor vision. So close one eye, one after the other, just to check your vision.
Thank you very much, sir. Close one eyes, everybody, and try to see if you can see. As Dr. Cyril is speaking, I think it would be nice you start trying it right now. Just close one eye like this and see if there is any problem. Close the other one. This is practical. It will help us really assess our eyes, because I know as Africans, most times people don't come to the hospital on time. They would like to wait and try self-medication before presenting to the clinic. Are there anything someone can do that will predispose him or her to blindness? What are those risk factors that might lead someone to losing the sight?
Okay, thank you very much. That's a very good question. Well, I'm going to talk about that on two ways, in two forms rather. There's the preventable, and then there's the non-preventable forms of blindness. The preventable forms of blindness um, describes those types of causes of blindness that are preventable by you and I. And one of that is stop playing with sharp objects. Trauma to the eyes is a common cause of blindness, especially among growing children and young adults. And so stop playing with sharp objects. That's the first thing you need to do. Stop playing with sharp objects, or do not let kids play with sharp objects. And because most times this leads to trauma and causes blindness. And this is preventable. Another form of preventable blindness is glaucoma. It's preventable because you could catch it on time and get treated and prevent or retard the progression of glaucoma. So much so that when you start treating glaucoma, you can actually die with good vision instead of dying with blindness. So, how do you prevent that glaucoma? Get your eyes checked frequently, at least once a year. For the non-preventable forms of blindness, those are the types of blindness that no matter there's nothing you can do about it, like cataracts. We're all going to grow old, and the older we get, the more likely the chance of us having cataracts. So check your eyes when you've got cataracts, or whoever's got cataracts, go for surgery. Surgery is effective and vision can be restored. And other forms of preventable blindness would include diabetes and blind from diabetes. A lot of us do not or haven't ever checked our blood glucose. We don't know if we're diabetic or not. And diabetes would cause blindness, but it can be prevented if we check our eyes or check our blood sugars as frequently as possible and get treated immediately we notice we have issues with our blood sugar control. Another form of non-preventable blindness is also related with age, is what we call age-related degeneration of the eyes. There's really nothing you can do about it. We're all going to grow old, and when it happens. But there are things you can do that would ensure that you have functional vision as much as possible for the remaining part of your life. So it depends on if the cause of blindness is preventable and not preventable. If it's preventable, then we have to do as much as we can to make sure we do not go blind, by checking our eyes promptly, getting our head checkups regularly, and stop involving ourselves in trauma in plays or activities that can traumatize the eyes. And for non-preventable causes, there really nothing you can do about it. Go check your eyes and let your eye doctor provide you the care you need to maintain your vision for as long as possible and as functional as possible.
Thank you very much. Dr. Cyril just mentioned it's advisable you check your eyes once in a year. If you have questions concerning your eyes or any question that relates to this topic, please, we'll be coming to your questions very soon. But I want to discuss with Dr. Cyril for now, and then when we have the time, we'll come to your questions. Sir, there is something that just came to my mind as you were talking, and it's the place of Nigerians when we have problems with our eyes. The next thing you hear is, I want eye drop. Someone tells you that, oh, I have an eye problem. The next thing is, I need eye drop. What would be your advice? Because this thing is common everywhere you go. You just see somebody say, my eye, I feel like I can't see properly. I need an eye drop. Would that be the first thing for someone to do if he or she has an eye problem?
No. Most people don't like hearing this, but you actually don't need eye drops. For all problems you have in your eyes, an eye drop is not the solution. Using an eye drop would actually cause more harm than good. So resist the temptation, resist that temptation to go get an eye drop for every complaint you have about your eye. Instead, like I always tell people, watch it. It may just be something temporary. Just watch it. And if it doesn't clear in, say, 2 days or less, then go see an eye doctor and get it checked. And who knows, maybe something you actually don't need an eye drop for, or maybe something you do need an eye drop for, and then the proper eye drop to be provided. So not every time an eye drop is the answer. Sometimes using an eye drop will actually worsen the situation.
Sometimes using an eye drop would worsen your situation. Dr. Cyril just said that. So please, if you know you are listening to us tonight and you're self-medicating with an eye drop, the advice would be for you to stop that immediately. There is one very important question, sir. The place of Gary and blindness. As Africans, people mention that if you drink Gary too much, you will lose your sight, that Gary spoils the eyes. Please help us address this once again, sir. The place of Gary drinking and the eyes.
Okay. I think Gary has got a bad rep just because yeah. It's not the problem of Gary, it's actually the problem of people who make Gary. Now cassava has got something known as cyanide in it. And so people when they make Gary because they want to either turn a quick profit or because they want to quickly get their products on the market, do not properly ferment the Gary. And so the Gary goes to the market with some cyanide. Now, because we love Gary a lot, we consume such Gary that was not properly made. We actually consume cyanide in little doses. Are we together? Are you guys with me?
Yes, sir. We can hear you loud and clear.
Yeah, good. So we actually consume Gary with cyanide in little doses, which add up and build up in our system. And the beautiful thing about cyanide is that it loves the eye. So we eat very little doses of cyanide in improperly made gari, and then we end up with problems with our eyes. That is how gari causes blindness. So unfortunately, people blame gari instead of blaming the people who, in their greed and laziness, push bad gari to the market. So if you must eat gari, please eat fermented, properly fermented gari. And I think that's why a lot of people prefer sour gari, because it's thought that the more sour tasting the gari product is, the more fermented it is. And so the more fermented it is, the less likely they're going to consume cyanide. And also, in the past, it used to be a problem. Vitamin A deficiency used to be a problem. And so people came up with this idea of putting oil in gari, which introduced vitamin A to our gari product. But thankfully, vitamin A is no longer a problem. So we're not going to be too finicky about having white gari or yellow gari. But I mean, should just eat fermented gari and don't eat unfermented gari.
So let's stop blaming gari and blame those who don't ferment their gari properly. These are the people that destroy our eyes. Gari should not be labeled as a bad product. Or if you're taking a gari that is not properly fermented, you can be damaging your eyes, as Dr. Cyril has said. We'll be going to your questions very, very soon. I have about 2 more, and then Dr. Israel would read all your questions. So please just start dropping your questions in the comment section, and then we'll take them. Sir, one more question. If I were to protect my eyes right now from blindness, what do I need to do? Let's say someone has a family member that has cataract. He's young, he doesn't have cataract, or has a family member with diabetes or hypertension. What would be your advice so that at least I can protect my eyes in the nearest future?
The best thing is to get your eyes checked. That's the best thing. There's nothing you can do. There's nothing else. At least once a year, go to your eye doctor and have a proper eye check. That's the only way you can prevent your eyes from going blind. Because you may a lot of, like, for example, glaucoma is a silent thing of sight. We think we're seeing properly, we're seeing very well, but something is going on behind our eyes, and we actually don't know what's going on. You don't know until you get your eyes checked. You don't know what's going on until you get your eyes checked. So the best way to protect your eyes from blindness is to schedule an eye checkup every year with your eye doctor. Get a comprehensive eye checkup every year. And that's the easiest way to get your eyes, to prevent your eyes from blindness.
In this part of the world where people have challenges with finance, would it be expensive to get the eyes checked, sir? Let's say in a place like Lagos, Abuja, Port Harcourt, what would be the range looking at? I don't know if you have an idea, sir, for someone that wants to get his eyes checked.
Honestly, I don't have an idea, but I would also say the cheapest bet would be a federal government teaching hospital or a state eye clinic. So I think it's going to be cheapest to a government-owned hospital, either federal or state. And private hospitals may be a little bit more expensive, but the wait times are less. But for government-owned hospitals are cheaper, but the wait times are more. And so I honestly don't know what the range would be now that the economy is so fluid and prices are so fluid. But I would still think that a government-owned hospital is cheaper, and as of now will be cheaper than private hospital. And so for a hospital, something maybe less than 10, 20 should sort it out, should give you a comprehensive eye check minus any other tests you may need to do. If you're going to have to do some other tests, and then we're thinking of, say, comfortably 50 in a government hospital. But without tests, without any tests, I think 10,000 should sort it out or less. That's for government hospitals.
Okay, thank you very much. Government hospitals will be better for those of us that find it difficult to visit the private because of finances. Let's take some of your questions. So Dr. Israel will be reading the questions, and Dr. Cyril would help us respond. Dr. Israel, over to you, please.
Okay, good evening, Dr. Cyril, and it's nice seeing your
Hi,
face again after a very long time.
how you
Um, this question is coming from Pastor Bright from Benin. Please, doctor, what can I do if I have the following problem? I'm observing dark spots seen in my view as I look, and dies sensation in my view.
I would want to say, if I understand that question correctly, you're seeing dark spots moving up and down. First question you need to ask yourself is, did it just start? Has it been there for a while? Are the dark spots increasing? Uh, if the questions are yes, 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 then you should go see your eye doctor. If the answers to the questions are, it didn't just start that, no, 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 then keep watching it. But if it's yes, at least two of those questions, go get your eyes checked with the doctor so that they can be sure there's nothing going on. So, three questions. Did it just start? Are they getting more? And are the dark spots getting worse? Did it just start or has it been there?
Thank you, sir. Please, ladies and gentlemen, help us share this live stream, share the video so that more people can join. We have another question here, Dr. Israel.
Yeah, this one said, Bisola is asking, what is the cause of dry eyes? What
Yeah,
is the causes, or what are the causes of dry eyes?
the commonest cause of dry eye is age. And so, question is, how old are you? Are you a female? If you identify as a female, if you identify as a female, are you postmenopausal? And dry eyes are common in females who are postmenopausal. Dry eyes are common in old people. Dry eyes are common in people who do a lot of outdoor work. Dry eyes are common in people who do a lot of screen time. And so, if you have a lot of screen time, work a lot of screens, you work outdoor, you're postmenopausal, and these are causes of dry eyes. And to treat dry eyes in these people would entail you identifying what is actually causing dry eye. If it's age or postmenopausal, there's really nothing you can do. We have what we call tear substitutes that help ameliorate the dryness you feel in your eyes. And if it's screen time, what you can do is observe 20, 20, 20. You look at the screen for 20 minutes, look away for 20 seconds, and stand up for 20 seconds, or just rest for 20 seconds. So take some time off the screen and then reduce the brightness of the screen, and that will help.
Thank you so much, sir. Okay, this is good evening, doctor. My name is Femi. Please, what is the cause of eyes inching? Because my eye always inch me all the time. The cause of eye inching.
Complex cause of eye change will be allergies. So if you got allergies, if you got allergies, you doctor they can properly find out what happens.
Sir, sorry, your network is not a little bit clear. We can't really hear you, sir.
All right. Is it better now?
Yes, it's better now.
Yeah.
Is it better now? Yeah. So I was saying that commonest cause of itching is allergies. And there's something you're allergic to. It could be your pet, it could be dust, it could be pollen, it could be anything. So the question is, do you have itching anywhere in your body? Have you got asthma? If you have you been allergic to anything in the past? If you've got allergies, then you need to see a doctor who will then try to find out what you're allergic to and provide you the correct or adequate medications or appropriate medications for your allergies. If you're a young chap, if you're young, the good news is that most young people grow out of their allergies. If you're elderly and it just began, it may just be what we call late onset atopy. And so your doctor is going to be in the right position to provide you with appropriate care and drugs for itching. It could also be because you need glasses. It could be because you're looking at your screen too much. And so you need to ask yourself all these questions and then provide these answers to physician or your eye doctor who's going to provide appropriate response and care.
Thank you so much, Dr. Cyril. Okay, is it possible to correct short-sightedness? Because I have been using glasses for 7 years now, no improvement.
This is a common question I get. People have this, they have this, have this wrong impression about use of glasses. People think that if you use glasses, it's like taking paracetamol, it's going to sort out headache. If you take paracetamol, the headache vanishes. If you take anti-malarials, the malaria vanishes. Unfortunately, glasses are not medical. Glasses do not correct anything. I like to tell people they're like your clothes. Is my audio good?
It was breaking before, but I think you are back.
Yeah, I noticed my network shake a little just now. So glasses are like your clothes. You do not stop wearing your clothes because you've been wearing clothes for the last 10 years and you think your nakedness is not covered. You still go out wearing clothes every day. Did you guys hear me?
Yes. Glasses are like clothes. You don't go out without wearing your clothes every day.
Yeah, so that's what your glasses do for your eyes. Look at your eyes as being naked, and then glasses are the clothes you wear on your eyes to cover them up and provide them with better function. So, thinking that your glasses will correct your refractive error wouldn't work that way. Glasses are not medication. Your clothes, you need to keep wearing them to give your eyes the function it needs.
Okay, we have another one here from Abisola. Abisola says, sometimes I feel something strikes my eyes and very painful. What is the cause and what can I do, please?
I do not understand the question. You feel something strikes your eyes. That really strikes your eyes. But if something strikes your eyes, you should feel pain. It's expected that you feel pain. So I really the question can be phrased and put context, have an idea of
Can you hear me, sir?
Yeah, I can hear you now. Did you hear what I said last time?
I know we didn't hear that. I don't know.
Yeah, I think my network is shaky. I don't know why. Can you hear me now?
Yes, I can hear you, sir.
Yes. So I said I didn't understand the question the last time. The last question that was asked, I did not understand the question.
Yes. Okay. Yes.
So if the question can be rephrased,
okay.
And
so Abisola,
context,
yes,
then I may
please
just be able to answer the question.
Clear so that Dr. Cyril can respond. So Colin is asking, I wear glasses. Is it a must my kids wear glasses too?
That's not a straightforward question to answer. Some forms of refractive error are genetically transmitted. Yes, that is true. But do I know if yours is genetically transmitted? Unfortunately, I can't say. Some forms of refractive errors can be genetically transmitted. That is true, but not all refractive errors can be transmitted. What I mean is this: some refractive errors can be passed from mothers to children, or from fathers to children, or from parents to children, but not all are passed. Now, can yours be passed? Unfortunately, I can't say because I don't know what refractive errors you got. I don't know if your parents have refractive errors and now you have a refractive error. What I can say is that if your parents had refractive errors from childhood and then you had refractive errors from childhood, it's most likely that your kids may use refractive errors from childhood. However, your parents are using glasses when they were older and not from childhood, then it's more likely that that refractive error was not passed from them to you. And if you start using your glasses from when you were older and not when you were a child or when you're young, it's almost likely that you may not have passed your children. So it's not a straightforward answer to give. It depends on a lot of factors which I do not have now. But just know that some refractive errors can be transmitted or not transmitted, can be inherited by children from parents, especially if the parents are in the child.
Dr. Israel, let's.
Yeah, okay, I'm here. Doctor, what could probably cause sharp pinching pain at is this okay at nosy side inside of the eyes? Please, I want to know what will probably cause pinching pain at the nosy part side of the eyes. That's the medial part.
I think, yeah, yes.
I honestly would not know. This kind of question would require that your eye be examined, especially maybe at the time you're having the pain. So if you have the pain again, you just go to your eye doctor, let your eye be examined at the time, then they will know. Most likely, maybe because you need to use glasses, most likely, but that is just a guess. I'm hazarding a guess. I honestly would not be able to tell you what could cause a sharp pain close to your nose. It could be anything.
Thank you, sir. Please, if you're just coming, you are welcome. We're talking about blindness, and we have Dr. Cyril Obasuyi, consultant ophthalmologist. Please help us share this live stream so that more people can be aware. We have another question from Ima, Dr. Israel.
Yeah, I'm not seeing that question yet.
I think I can see a short-sighted person more likely.
Yeah. Yes, is a short-sighted person more likely to go blind compared to someone who have correct eyesight?
No. There is nothing that says someone who is short-sighted will go blind faster than someone who has correct sight. A lot of factors come into play in determining who goes blind first or who goes blind faster. So no, a short-sighted is not more likely to go blind faster than someone who has correct eyesight. The person who you think will have correct eyesight will also have something that you don't know about. So there are a lot of factors that come into play that determine who goes blind faster. So, but just be sure that the short-sighted person will not go blind faster than someone who's got correct vision.
Thank you so much. Immaculate is asking, my eyes are always itchy, especially when I wear contact lenses. What do I do?
First response will be stop wearing contact lenses. Apparently, your contact lenses are not the right fit. They're either too tight. Secondly, it's possible using the wrong contact lens fluid. And to protect your vision, stop wearing contact lenses and then go somewhere you can get proper contact lens and use the right fluid. If your eyes are always itchy when you wear contact lenses, please stop wearing contact lenses, because most likely contact lenses are not the right fit, or there's something wrong in the process of fitting your contact lenses. Most likely the fluid using to store the contact lenses. Also, most people wear contact lenses for too long, even when the contact lenses are not meant to be worn that long. That can also cause very serious problems. I know we like using contact lenses, but contact lenses need to be worn appropriately with the utmost hygienic practices, because it can lead to visual loss as fast.
We were having a little issues with your network, sir. I think we have another one here. We have another question here from Grace.
Okay, from Grace. Good evening, doctor, and our guest doctor. I've been having this eye issue for the past 5 years now. My eyes itch, sometimes red. It will look as if there is sound on my eyes, and last month I saw blood at the center of my left eye. I cannot use my eyes to see clearly under the sun, my left eyes especially.
Yeah, you complained about a lot of issues. Off the top of my head, I would assume you have allergies and you need to have it sorted out. And also, I would assume you've got something also going on that you need to get your eye checked up for, especially your left eye. And so I want to say, please go check your left eye out properly and try to find out what triggers your itching and redness. You've got allergies there, off the top of my head. And then if you're a little bit older, then I would also want to say you may be having some dry eye. And so I don't know how old you are, I don't know male or female, but off the top of my head, I would say you've got some allergies, probably dry eyes, and there's something else going on in your left eye, which I would advise you to go get the proper checkup.
Okay, thank you very much. Kenneth is asking, my right eye suddenly stopped seeing what should stop seeing. What should be the problem?
If your right eye suddenly stops seeing, please, you should have been to an eye doctor already. And there are a lot of things that makes your vision stops. The vision that stops vision immediately. And sudden loss of vision is not something we like to hear about from ophthalmologists. So please, if you can't, go get your eyes checked by an eye doctor.
Okay. Sir,
Kenneth, please.
your network is breaking a little bit, sir. I don't
Yeah,
know.
so what I said was, if your eyes stop seeing suddenly, sudden loss of vision is not something we like to hear about as ophthalmologists. So if you have sudden loss of vision, especially unilateral in one eye, you should be to see your eye doctor immediately. Go see an eye doctor immediately. You should have done that like yesterday. So
Hmm.
please go see someone tomorrow. Let the person get your eyes checked out.
Okay. Adebisi is asking these
Okay.
questions. Let me read this one, Dr. Israel, quickly because of time. It says,
Okay.
good evening. Doctors. I had a trauma in one of my eyes years ago and recently noticed the eye is not seeing well. I went to the hospital and the doctor said she suspected glaucoma. So I did test and later got glasses that turned dark in the sun. Question number one, does ultraviolet light glasses also block blue light? Because I press phone a lot. Number two, is it safe for someone like me to continue programming work, which requires me to face the screen a lot? And number three, what advice can you give to me, sir?
Yeah, number one, UV light glasses are very effective in bright sunlight light that emit a lot of rays. And so they work a lot on the best sun. If you want blue light blockers, then go get blue cut lenses. Blue cut lenses will filter blue light out. They're very good indoors. And so you can use photochromic lenses, which is what you've got in the sun, photochromic lenses in the sun, and then get blue cut lenses to be used indoors. It's very safe for you to continue using your screen. There is nothing that says you can't you stop using your screen. Keep using your screen. However, like I mentioned earlier, practice the 20-20-20 rule. Use your screen for 20 minutes, look away for 20 seconds, and do something to your eyes that is not screen related for another 20 seconds. And do that frequently, and your eyes will thank you.
Okay. We have another question from Grace. I was giving glasses sometime last year. The optician said it's only glasses that can correct it, that some nerves are damaged. How can the nerves be corrected without glasses?
So glasses do not correct me, like I mentioned earlier. Glasses are like your clothes. Glasses are like your clothes. You wear glasses because without the glasses, your eyes are naked. Whatever nerve is damaged will be corrected by medication that treats whatever nerve is damaged. So if it's glaucoma nerve damage, then you need to be on glaucoma medications. If it's something else that has damaged the nerve, then you need to be on treatment for what's damaged the nerve. Glasses do not treat anything behind the eyes.
Okay, Grace, you read. Hope is asking, doctor, for a glaucoma patient, eye drop is recommended, and this eye medicine, eye cap, does this mean this patient will continue to take this eye drop and pills continuously? Let me add that to the patient question. I think that was supposed to be part of it.
Okay. One thing you know is that glaucoma treatment or glaucoma care is for life. You don't stop it. There's no time you're going to stop it because the medications you take or the medications we provide you to treat glaucoma helps reduce or retard the amount of damage glaucoma does to the eye. And so if you stop the medication, then the damage would increase or worsen. Is my audio there? Do you have my audio?
Yeah, your audio is fine. Yeah, your audio is fine.
So great. So if you start glaucoma medications, please, glaucoma medication is for life. You have to keep taking it because it prevents damage from worsening, even though we can't completely stop it. It prevents damage from worsening. So please keep medications.
Okay. Kenneth is asking, my right eye, it can't see well in the year 2020. Someone hit me in the eyes. After the treatment, it was normal. But last year, 2021, it stopped seeing well.
Yeah, I think this was a question. This is a follow-up question to the one that talked about the sudden reduction in vision.
Yes.
Yeah, I still would say that please go get your eyes checked by your eye doctor. I think that's the best thing to do. Go get it checked by your eye doctor.
So Grace is asking, my eyes always brings water. What should I do?
Yeah, three things really. Either you got allergies, or you got dry eyes, or you need to wear glasses. You can only answer these three questions again if you go get your eyes checked. So you see, the recurring theme here is please go get your eyes checked because you really do not know what's wrong until your eyes are checked.
Thank you very much. He said, good evening, sir. I have cataract on my two eyes, but it's not disturbing me yet. Can I go for the surgery or not?
When I started, I discussed blindness in terms of who we are talking about. For a pilot, blindness is different. For a market woman, blindness is different. For a politician, blindness is different. And for a medical doctor, blindness is different. And if you've got cataract in your eyes, but you think you can still function appropriately and adequately well, knowing that we don't have insurance in Nigeria and cataract surgery is expensive because of that, and you can't afford surgery now, I would say wait till you can afford surgery. However, if you perform duties or you have a job that requires very good eyesight, I would suggest you go have your surgery currently. Excuse me. However,
Sorry.
if you think you can still cope with your vision currently and your job or what you do does not require very fine or very precise vision, then you may need to wait till you can afford it. If you've got insurance coverage, then please go have a cataract surgery. In advising you to go for your surgery, we have to take into consideration the fact that not everybody has got insurance in the country and not everybody's insurance will cover cataract surgery. and not everybody may have the funds to cover the cost of cataract surgery, even in public hospitals. So that is something you also have to consider.
Okay. And this question is said, good evening, doctors. Please, how effective is the surgical treatment of glaucoma? Because the pressure of the eye keeps getting high despite treatment.
Yeah, surgical management of glaucoma is very effective. And the goal of glaucoma treatment is to keep the pressures within manageable numbers. And so if your pressures are still very high and you've been offered laser or surgery, please don't hesitate to take the offer of. Surgical management or laser management of glaucoma is very effective. And unfortunately, it may be a little bit expensive, but it's very effective.
Thank you very much, sir. No more question, and we are almost done tonight. Sir, I want to ask you one question that is not linked directly to this topic. I want to ask, in your practice, sir, what funny case have you seen that led to blindness of a patient, let's say out of ignorance? You know, as Africans, we can practice so many things to help our eyes. What have you seen, sir?
I can think of two. One, somebody had what we call Apollo and put breast milk in the eyes. And then someone had Apollo also and was told to put cement in the eyes.
To put what? Cement?
Cement, yeah. And so we have a lot of practices that were passed down that we think work, but actually do not work. Like breast milk in the eyes. I've known people who put cow dung in the eyes. I know people who put poultry droppings in their eyes to wash the eyes. I know people who put awolowo leaf. I know people who put a lot of things in the eyes, like cement is just one of them. I know people who have put fertilizer in their eyes because they want to fertilize the eye to see properly. So a lot of things that are done out of ignorance, out of practices that we do not know are harmful, and then lead to blindness. Such practices are very difficult to treat. A lot of things are going on in the eye, and most times lead to blindness. So, I mean, a lot of people put a lot of things in their eyes to be surprised.
Thank you so much.
Wow, wow. Cement in the eyes. How? What's so did that person lose the eye?
Yeah, cement is a very, very corrosive substance. And so unfortunately, person didn't come at once. You come when should have come, came like a week after. There was really nothing we could do. Unfortunately.
Wow. Thank you very much, sir. I think we are almost rounding up. So what would be your advice for everyone listening for us to help our eyes with regards to our lifestyle, our diet, what we do? What would be your general advice, sir?
Yeah, my advice is don't put things in your eyes. No matter how much you think that thing may be harmless, it may end up being very harmful. So please stop putting things in your eyes and not even eye drops or any. The only thing that should go in your eyes is water. Only water. Plain water is the only thing that should go in your eyes. Secondly, try to eat good food. Good food does not mean you must eat expensive food. Good food means adding some ugu to your food, adding some palm oil to your food, eating some egg if you can, having some fruits if you can, and generally stop playing in quote rough play, especially children. Stop playing rough play. We have a lot of we get children who come in with injuries to their eyes because of stick or broom or biro cover. I know someone who used rubber band to shoot a biro cover, hit someone's eyes, a child's eyes. I know most times when the damage is done, There's really nothing you can do to bring back and the eyes from such damage. So eat some palm oil, have some fruits, have some vegetables in your meals, and then put only water in your eyes. When you're in doubt, go get your eyes checked by your eye.
When you're in doubt, go get your eyes checked. Ladies and gentlemen, you just heard Dr. Cyril Obasuyi, the consultant ophthalmologist from the Irrua Specialist Teaching Hospital. It was great having you here to talk with us concerning blindness. We really appreciate you, sir. And everybody, please just drop in the comment section, maybe the clapping sign or thank you to Dr. Cyril. He answered so many questions today. I think we will take so much questions. Dr. what do you think?
Yeah, Dr. Cyril, want to really say a very big thank you for coming. I'm glad seeing your face again. You can still remember he actually advised me to always get my own eye check every year, once a year, and I think I've been doing that once in every year. Because of he said I looked inside your eye and what I'm seeing is not clear. So since then I've been actually checking my eyes once a year, and I still hope to see him. He has started the treatment, so
I
that
looked
he
inside your
still
eye.
look at the eyes and say, okay,
Clear.
what I'm seeing is clear. But thank you so much for being with us today. I really
Thank you.
appreciate you for doing us today.
Thank you so much, sir. We're uploading this video immediately after we have ended. It will be on Facebook. It will also be on YouTube so that those who missed can go back and watch it. Thank you, everybody, once again for joining us. Thank you, sir, for coming up tonight. We appreciate you, sir. Ladies and gentlemen, this is Ask the Doctors every Sunday by 8 p.m. We'll always hear. I think next week Sunday, Dr. Israel will be doing a question and answer session, right?
Yeah, well, okay. No, for this month, I think from this month, from the first Sunday of this month till now, which is like 3 Sundays, we'll be having guests upon guests, and they've said a lot of things. So we want to use the next Sunday as question and answer, so that every questions that were not answered during that period, and the others that we didn't talk about, we'll use that Sunday to answer those questions. Who is doing birthday? We'll use that period to answer those questions.
Who's doing birthday, Grace? I don't know who's doing birthday. Huh? Grace, leave me alone. Okay, everybody, we really appreciate every one of you for coming. And today was about eyes blindness, and we try our best to make sure that this platform you can get accurate information. We'll be grateful if you can share these videos, invite your friends to come here and join us. Okay, it says me, my birthday is Wednesday. I think it's on Tuesday. Okay, my birthday is on Tuesday. Somebody should buy me private jets. I wouldn't mind. Yes, like we always say, good life.
Not sense.
Good life, not sense. Thank you, everybody. Have a wonderful night. We're able to work with time today. We worked within 1 hour. Thank you. God bless you and have a lovely night. Take care. Bye-bye.
See ya.
Au revoir. Au d'abord.